Hi, everyone, and welcome to the Linebird Wings. I'm Gal Newman-Vexler, partner at Linebird, and I'm so excited to be joined here today by Avit Warshador from TELUS Global Ventures, the strategic investment arm of TELUS Corporation. Today's talk will serve as a companion resource to the Women's Health Validation Cheat Sheet we co-developed together. This cheat sheet will go out to all the women's health founders that never even knew that's what their startup is in the world of chronic illness and other areas we'll discuss later on. This cheat sheet is a unique piece in our Wings series that we co-developed with our partner TELUS, a global leading digital health company. I want to thank Terry Doyle, managing partner at TELUS Global Ventures, and Dr. Matthew Chow, Chief Mental Health Officer at TELUS Health, for their contribution to this piece. And before we dive deep, I'd love for you, Ravi, to tell us a little bit about your background and also a little bit about TELUS and their interest in women's health.
Hi, Gal. Thank you. Thank you so much for having me. I'm excited to be here and to build on the work that we did in Women's Health Validation Cheat Sheet. It's so important that we're having this conversation. Chronic conditions and then personalized care are where the volume is, where the cost is, and where the gaps are. But they've been hiding in plain sight, especially when it comes to women. Let me maybe start with a bit of a background about myself. So I began my career as an engineer, working across telecom and media sectors. And over time, my passion gravitated towards the digital health space. And then I spent most of my career embedded in the Israeli startup ecosystem. I've had the privilege of helping scale multiple health tech companies, and later took on a national role at the Israeli Ministry of Health as head of innovation for digital health. From there, I joined Comet Ventures, leading the Tel Aviv office of the Venture Builder. And then I joined TELUS Global Ventures to lead strategic investments across many sectors of the business. TELUS Corporation is a world-leading technology company with deep commitment to social impact, delivering innovative solutions across telecommunication, digital health, agriculture, sustainability, and more to improve lives and communities. And TELUS Global Ventures, or in short, we call ourselves TGV, we invest strategically for the TELUS Corporation. We are a very active corporate VC with more than 500 million USD in AUM that has invested in more than 100 innovative companies since 2001. And women's health remains a particular area of focus for us, especially given TELUS's long-standing commitment to transforming the health system. Women's health and chronic health affect a significant part of the population and is a major cost driver. And at TELUS, we're looking at this space across all parts of TELUS Health business unit and beyond. So maybe I'll tell you a bit more about TELUS Health. TELUS Health is a division of TELUS Corporation, and it's one of the largest digital health and wellness organizations globally. It provides a wide range of technology-enabled services aimed at transforming healthcare delivery, improving patient outcomes, and supporting the overall health ecosystem across Canada and internationally. TELUS Health operates at the intersection of telecommunication, health IT, and clinical services, and leveraging TELUS's infrastructure and technological capabilities to offer integrated end-to-end healthcare solutions. Our core activities and service areas, we have virtual care and primary care. So through platforms like TELUS Health MyCare, we enable access to licensed physicians, mental health counselors, and dietitians via secure mobile and web applications. We also have electronic medical records, EMRs. So TELUS Health is Canada's largest provider of EMR solutions. We're serving over 30,000 clinicians. And we digitize clinical workflows, so to enhance patient data management and support clinical decision-making. We also have the health benefits management part of the organization. We administer over 130 million health claims annually through our platforms, supporting more than 12,000 pharmacies, 30,000 extended healthcare providers, and numerous insurers. And we also have the home health monitoring unit. We partner with provincial governments and care organizations to deliver remote patient monitoring services at scale, especially for chronic conditions and post-discharge follow-up. And finally, last but not least at all, it's actually the largest volume of our activity. We have the mental health and EAP, employee assistance programs. So after acquiring LifeWorks in 2022, TELUS Health now provides EAP, mental health and well-being services to over 69 million people globally through more than 50,000 organizations. So a very large scale of activity. And this broad footprint gives us unique vantage point to understand what works and what doesn't work in digital health and what's needed to scale solutions that improve care, lower costs, and address inequities.
The discussion today focuses on a very specific, important domain that touches all of us, women's health. Actually, the guys as well, when you think about the fact that women are also lots of the time taking care of the entire family unit in terms of healthcare decision making. Now, today we'll be cutting through the different buyer types and cover women's health from the perspective of female-dominated chronic conditions, and why founders need to think differently about it, and where does it meet chronic illness if they want to build impactful, scalable solutions. You might even finish reading this and understand that you've built a women's health startup all this time and you never even knew it. Now, to anchor the discussion for everyone listening, the framework that we use today focuses on 3 essential components you need to be thinking about in order to create that lovable, engaging, and commercially successful product in women's health. So the first is standing out in the crowded landscape. To get real traction, you need to stand out in the context of a buyer's relative priorities. The first section of the cheat sheet will help founders identify which value propositions resonate with different stakeholders, whether you're addressing clinical gaps, engagement challenges, or equity goals. The second will be planning for adoption and integration of hurdles. Women's health often spans multiple specialties, care settings, life stages. That means solutions need to navigate fragmented workflows, legacy infrastructure, and sometimes even implicit bias. This part of the framework helps founders think about how to position their product for a smoother integration and uptake. Lastly, we'll talk about understanding budget pathways and decision-making dynamics. One of the biggest pitfalls we see is when teams don't know where the money flows. Women's health often falls between lines: primary care, OB-GYN, chronic disease, mental health, employer wellness. All that can ruin a deal if you don't know who you're targeting and where will it go next. This section is about helping you founders identify which budget lines you're tapping into and how to align with the incentives of the different buyers, whether we're talking about a provider, a health plan, or an employer. Finally, we'll tackle 2 specific areas that we view as of highest importance or that are just simply very common when it comes to women's health. The first is mental health, which is over 1.5x times more likely to occur in women and influences a lot of comorbid chronic conditions. The second is precision medicine and longevity, a rising trend that is even more critical when it comes to the female population due to historic diagnostic and therapeutic gaps across many disease areas. Both these areas get our special attention because they also vary across a woman's life cycle. So it's very important to pay close and continuous attention to them. Now, if you are following our cheat sheet, in addition to this conversation, in the beginning, we talked a little bit about how this space did not always get that right definition. So let's start today by redefining the field, or at least emphasizing the neglected part of it. Women's health, or femtech, still gets boxed into reproductive health, periods, pregnancy, fertility, but that's only one piece of the pie. And that misses the majority of disease burden that women actually face, right? And in general, there are quite a few diseases that occur in women far more frequently. I'd love to get your thoughts on that, Pavit.
Exactly. So reproductive health is essential, but it's just one part of the story. So when you zoom out, the real story is most of the global chronic disease burden falls on women. Think about conditions like autoimmune disease, where 80% of the patients are women. Migraines are 3 times more common in women. IBS, irritable bowel syndrome, chronic pain, depression, musculoskeletal disorders, all are significantly more prevalent or severe in women. And even cardiovascular disease, the number one killer of women, is routinely underdiagnosed because it presents differently than in men, different symptoms. And yet, these are rarely labeled or funded as women's health. So solutions get overlooked or underbuilt.
And what founders don't always realize is that if you're building a product for chronic care, oftentimes you're already in that women's health business. Where do you see this often take place in the companies that you guys are talking to, Wafit?
Ideally, founders and companies will be aware of it and take it into consideration when building and selling their solutions. At TELUS, we are acutely aware of how healthcare systems have historically been designed with a default male patient in mind, leading to this underdiagnosis, misdiagnosis, or dismissal of symptoms in women, particularly in areas such as autoimmune disorders, cardiovascular, as I mentioned, chronic pain, ADHD, and also perimenopause. As the largest provider of EMRs in Canada, we have a clear view into what is and isn't captured in standard clinical workflows. And while EMRs are excellent in documenting structured medical data, they often miss key experiential inputs that disproportionately impact women. Things like pain intensity, or menstrual patterns, fatigue, or hormonal fluctuations. These things are typically not documented anywhere. So we actively encourage founders to identify and to capture these under-recorded signals. Whether for chronic pain, again, endometriosis, autoimmune conditions, these data points often represent both the moat, the sustainable competitive advantages for the startup company, and also the missing layer in the diagnosis itself, the personalization, the long-term care planning. Solutions that can augment the traditional EMR data with rich patient-reported inputs, these solutions have a distinct edge in driving both engagement and then clinical value.
I want to talk a little bit about one piece of the chronic condition puzzle that is important to highlight, which is the fact that it's very dynamic. And one of the most overlooked drivers of chronic health are differences in menstrual cycle. We often see conditions like autoimmune conditions as one example, but MSK diseases is another, that have flare-ups or just very changing patterns that have been correlated with hormonal patterns that vary across a woman's life stages. Can you explain to us why hormones matter so much in the context of chronic care and what you feel we can do about it?
Yeah, so we know today and for a while that hormones shape everything. Estrogen and progesterone, as examples, their fluctuations affect pain sensitivity. It affects immune response, appetite, sleep, mental health, and it also affects how we metabolize drugs. So if you come to decide on dosages, that means it makes a difference. That's why the same chronic condition, even something like asthma or hypertension, can behave differently in women depending on their cycle phase. Or why two women with the same diagnosis might need different care plans if they're during menopause versus postpartum, for example. Yet most of the care models are still ignoring these dynamics completely. From a TELUS Health perspective, our investment in companies such as Eli Health reflects this thesis, leveraging novel biosensing and hormonal tracking to address cyclical and reproductive health with the nuance and precision that women deserve. It's important to mention, however, that Eli Health, as an example, is targeting both men and women. So it's actually a great example of how much we can learn from women's health towards care in general. So the company does not need to target just women, but their go-to market that is potentially starting with women is an interesting one.
I think that it's a great example for where personalization and user engagement become critical. And, we're always talking about personalization as a good driver for better care, but it also drives just better outcomes and adherence when we have patients that are enjoying the use of good digital health products that are accurate and customized to their specific current needs. In the first part of the cheat sheet, we talk a lot about user trust and behavior and product design. This is an area that is often talked about when it comes to digital health, but that extra mile of talking about how we're building it differently for both genders is critical, especially when we're trying to engage a sick population or an older population that you will need to hit just the right points to get that great US matrix that you want to get. So, can you elaborate a little on where you see your portfolio companies touching on user engagement and how you think about the different experiences the different users expect to get from digital solutions that they use? Obviously, using that gender lens.
Yeah, as you said, personalization is not just about better care, it's actually about care that actually gets used. So when a solution reflects a person's symptoms and experience, including their caregiving responsibilities or hormonal shifts or coexisting conditions, it becomes inherently more relevant and as a result drives better engagement. We can take Vera Health as an example, a TGV portfolio company. They are creating continuous personalized engagement throughout menopause, aligning care with changing symptoms and health conditions over time. Their product, it's named Stella, ensures that support is timely, accessible, and also emotionally attuned. And they offer care paths that are adaptable and flexible, whether through digital-only engagement or with clinician-led interventions. Their platform supports everything from mental health programs to prescriptions tailored to women's needs across menopause and beyond. And this level of product flexibility and personalization is what drives both adherence and outcomes. Vera Health actually offers its platform through multiple channels, including employers, where it's accessible not only to women employees, but also to men who can extend the benefits to their partners or other family members. And we found that very interesting. I think this reflects a core understanding that women's health has ripple effects across households and communities, and that enabling access to such solutions benefits everyone. So not just the women themselves as direct users.
Yes. And I think, this is definitely one of the areas that is not talked about enough, which is at the end of the day, when we're talking about women's health, we need to also think of her as a caregiver in many cases, as someone who is driving the, the well-being and health oftentimes of other core family members. And this is substantial when you're thinking about it from the perspective of an insurance company and employer, because they are enjoying the costs of all these family members combined. And as a result, that this must become a priority when they're thinking about what challenge to tackle and what cost driver to focus on. So the gaps in women's health aren't simply clinical, they're systemic. And like I mentioned, women often act as primary caregivers, health decision makers, and key users of health systems. But in real life, health solutions fail to reflect this reality. From your vantage point at TELUS Ventures, how do you evaluate companies that are tackling these inequities?
Yeah, so that's an important framing. Our approach is twofold. First, we look at where the inequities show up, whether it's delayed diagnosis or unmet mental health needs, fragmented care journeys, under-recorded symptoms, lack of personalization across hormonal life stages. So that's one. And then second, we ask whether the company is meaningfully solving for these gaps, not just acknowledging them. We advise founders to recognize that many healthcare decisions are actually driven by women managing the needs of others, often across children, partners, and aging family members. The research actually shows that women make 80% of healthcare decisions for their households, which is a very high number. As an example, at TGV, we've invested in companies like HomeThrive, which provides caregivers with personalized support through a combination of digital tools and expert guidance, helping them manage the emotional, logistical, and clinical complexity of family caregiving. We've also backed a company called Clinia, which offers intelligent infrastructure for care navigation, enabling health systems and platforms to surface the right providers and services based on nuanced real-world care journeys. And this is especially valuable for users managing multiple health needs across a household. Both these investments of ours represent distinct but complementary approaches to solving for the decision maker, which is often a woman, who is at the center of the healthcare experience. Similarly, Melly from the Lambert portfolio brings a vital lens to this space as well by addressing the diverse needs of caregivers through accessible, personalized support designed specifically for the unique stressors they face.
Yes. Yes, that's true. And we definitely see a lot of the time that one of the biggest challenges that caregivers are often faced with comes with the logistic and the planning that takes a significant part of their day to day, which of course is a burden on their employers and not necessarily the healthcare component of it. So next, I want us to talk a little bit about data. So our next, for those of you that are following, the next question in our cheat sheet, we talk about what you need to be thinking about when you're building a data-centered solution. Now, data is king. We often say that, definitely in the era of AI, although it has become more accessible. But sometimes it is difficult to capture its true value in terms of financial and clinical impact. Now, from the perspective of chronic conditions, they tend to be highly heterogeneous in nature, but the data sets that we build on are often not so heterogeneous as we would like. So in this part, we wanted the founders to think a little bit about building the best data approaches to master that challenge and really scale your company in the realm of women's health. And again, focusing on that female-dominated chronic condition perspective. Now, just to give you an example, Theranica from our portfolio has developed a digital solution or digital drug, if you will, for treating migraines that, as Ravit pointed out before, are far more common in women than they are in men. Now, what they have built is a massive database related to migraines based on their usage of their mobile app to consume the Theranica digital therapeutic, Nerivio, and really understand beyond the pill data of how it is correlated to your everyday life. Now, the company's ability to analyze gender usage patterns separately has really contributed significantly throughout their development to the evidence-based nature of their solution and how well it replicated across multiple clinical trials. Now, Ravid, I want to turn this to you and to ask you, what should founders be keeping in mind as they are building the next data-centric product that will drive an impact in the realm of women's health?
Yeah, the case of Theranica is great. We advise founders to differentiate their clinical models by gender where appropriate. Women often present with internalizing symptoms such as fatigue or rumination or somatic complaints that may be under or misdiagnosed if the platform is trained on male-centric patterns. So a few things to consider when you're designing the data that supports your product, especially when we're talking about women's health. First is your training data balanced by sex, age, and race, right? You need to include women of all types and ages, and of course, men as well. Are you capturing the non-clinical variables like menstrual history, symptom logs, or caregiver stress? I mean, you need to identify all those things that are affecting your product behavior and make sure to include them. Is your data unique or differentiated in a way that supports your innovation? As mentioned before, this can be your greatest moat. Are your models stress tested for false negatives in women, especially for conditions like autoimmune or ADHD, where women are frequently underdiagnosed? In today's AI-driven landscape, building a strong and sustainable solution requires thinking strategically about how your data can serve as a competitive moat. So just to summarize, data equity is foundational. If your AI does not see female biology, it won't serve women. So no matter how elegant your interface is. An important question around data is, can your platform support adaptive care, learning from patients' outcomes and feeding that back into the treatment models? This is one of the most important dimensions of long-term defensibility in health tech. Static protocols quickly become outdated, and platforms that learn from real-world outcomes and adapt become more precise, more personalized, and more valuable over time. I would say it's a must, right? So one of our joint portfolio companies, actually, of TGV and Lionbird is Rhino Federated Computing. They enable this kind of learning, not just within one institution, but across distributed clinical networks using privacy-preserving federated learning. Their platform allows AI models to continuously improve based on diverse, decentralized patient data without compromising privacy, and that's a breakthrough for scalable and adaptive care. We believe that adaptive systems will define the next generation of healthcare, not just treating patients better, but learning from every interaction to actually inform the next one.
I think that the case of adaptive nature of systems in healthcare is definitely critical when we are considering the fact that we are dealing with conditions in the context of this piece that are dynamic and are very, very diverse in how they manifest. Now, data is an important part to think about when we are building a startup. But if you are not harnessing it to move the needle financially for the healthcare organization that you're selling to, it just won't matter. So in essence, the data is an asset, but is also a means to an end. Now, zooming in for a second on cost. Chronic conditions are a huge financial cost driver, but many people just don't realize today just how gendered that burden is. Can you walk us through that, Ravit?
Yeah, sure. As I shared in the beginning, TELUS Health is both a provider and a payer, and also a very large EAP, Employee Assistance Program, selling to employers globally. So we see the complexities across the health system as a whole, and many times when we meet with a new startup or a product, we have the privilege to explore what would be their best go-to-market path within our organization. When you're pitching a chronic care solution to employers, frame it in terms of retention, productivity, equity, and caregiving enablement. We have some data from TELUS that shows that women miss more work across all chronic conditions, that mental health related absences are higher in women, And also that caregiver stress, which often leads to attrition or underperformance, is disproportionately borne by women. So that's on the employer side. If you're selling to payers and providers, you need to highlight how your platform can reduce diagnostic delays, lower medication waste, or support value-based care by mapping the outcomes to quality metrics. Sometimes the chronic conditions that you're solving for is substantially more common in women and so expensive to the health system that it will make more sense. The initial go-to-market will be women-focused. Of course, not always, but this is something to consider.
Yes. And at the end of the day, what we see often in Lionbird is that the biggest challenge for early stage founders is to crack that initial go-to market. And at the end of the day, you need to find that first use case that will be big enough and successful enough to continue from there. Now, in the next section, we talk a little bit about commercializing your product. And for many digital health companies, especially in women's health, we see that breaking into payer systems or employer budgets is a long road. And when we are talking about chronic conditions, and we're talking about changing members' behaviors at sometimes and actually preventing these situations and these costs, it's very, very challenging. And it's very challenging also to convince these stakeholders to take your solution among the many vendors that are talking to them. So, Ovid, how do you advise teams that are navigating these long and tedious sales cycles?
Founders need to be mindful of the long sales cycles in healthcare, and they need to plan accordingly. At TELUS, we welcome early conversations with teams in their design and validation phases, but we're also very transparent about our process, which is, it takes time, right? So forming commercial partnership with us often takes time, and we typically engage more deeply with the later stage companies, those that have already demonstrated product market fit and are already beginning to scale. Depending on the use case, TELUS may not be the first to adopt a solution, but for some solutions, we will need to wait for the full clinical evidence before we can implement at scale. But there's more than one type of evidence. So a clinical trial might take years, but you can begin by showing fast wins on operational metrics, for example, triage accuracy or appointment adherence, or you can measure the level of engagement that you have with the NPS measurement and Net Promoter Score. These indicators are things that we're used to seeing with startup companies, and these can reduce short-term cost drivers and earn the trust from customers, and TELUS is one of them. The way that the company grows over time is also meaningful. I mean, building the integrity with the customers, designing for ROI along the way, adapting the ROI along the way, and validating every step is how you eventually get to those large enterprise contracts. Again, you need rigor, and you need patience, and you need to be very professional.
Focusing on a specific pain that we see oftentimes here, do you see an opportunity in how fragmented women's care journeys are? A lot of the time we talk about how disconnected OB/GYN and primary care and mental health and chronic illness are, and their services can definitely feel for the user, especially in systems that weren't built with women's needs in mind, and that they're not necessarily also interacting with one another. And considering the fact that we're talking about a decade-long journey, this fragmentation actually becomes significant. What role do you see digital health playing in bridging those gaps in care? And do you think that's where you'll see employers and health plans taking more risks and making their bets?
This is immense opportunity, actually. It's not just about more access, it's about connected access. Take our portfolio company, Vera Health, that I mentioned before, and their Stella app. They are building longitudinal engagement models where menopause care isn't just a standalone service, but it's an integrated part of women's overall health journey. It creates a foundation for referrals, chronic condition screening, and ongoing health literacy. We also invest in platforms like GotCare. GotCare connects patients and providers through virtual and asynchronous touchpoints. It's actually a tech-enabled care, but also human-centered, ensuring that even patients with limited resources aren't navigating their conditions in silos. GotCare supports community-based, culturally aligned care that is especially relevant for women in rural and marginalized populations. So it has this additional impact, and it also supports a workforce of caregivers, many of whom are women. So ultimately, solutions that think about continuity of both care and data are the ones that will scale and will stick.
I think that we're getting to that last section of the cheat sheet. Let's zoom in for a second on two areas that are highly prevalent domains in women's health. So the first is mental health, an area that is especially underaddressed, particularly as it intersects with physiological changes, trauma, and multiple chronic conditions. It's an area near and dear to my heart as a scientist, clinician by training in the world of mental health. There is a gap to be solved there that we're not even scratching the surface. Now, these complexities often manifest differently in women, but most of these solutions still take a one-size-fits-all approach. And I think that stigma and gender, especially when it regards to women in their diagnosis and treatment, is still unsolved. In the last few years, we've seen a spike in innovative solutions in this realm, particularly post COVID-19 pandemic. And a lot of them were dealing with the similar challenge of how do we quantify mental health and improvements in mental health specifically, and also very similar to other areas in medicine, what do we do about labor shortage? Because at the end of the day, we need people, we need clinicians to treat these patients that are suffering, these women. So what are you seeing in this space? I know that TELUS is heavily invested there. And how are you evaluating companies in the sphere of mental health?
This is, as you said, an incredibly important area, and one where we at TELUS Health and also at TELUS Global Ventures, we feel both a strategic and a moral imperative to act. The mental health burden is massive and often invisible. Chronic illness increases the risk for depression and anxiety, and vice versa. Untreated mental health conditions worsen physical symptoms, impair self-care, and increase the healthcare costs across the board. For women, this loop is even tighter. TELUS Health data, so data that we have, it shows that women not only experience more chronic conditions, but also they miss more work, report higher distress, carry more caregiver burden. And when you add hormonal mood shifts or trauma history or social roles, you start to understand why mental and physical health must be designed together, not in silos. At TELUS Health, mental health has become a core pillar of our services, as mentioned, and particularly since our acquisition of LifeWorks, which significantly expanded our employee assistance programs, EAPs, and mental wellness offerings globally. So again, as mentioned, we now serve more than 69 million people in over 160 countries, including many women employees navigating care responsibilities, chronic stress, and hormonal shifts such as perimenopause. From the venture side, let's talk about the mental health side for a moment. We've made strategic investments in companies like TalkLife, which is a peer-to-peer mental health support community that creates trusted, stigma-free environments for younger users who may not yet access formal care. It's a highly scalable way to reach people in moments of distress and isolation, especially relevant for women and girls who are often overrepresented in early anxiety and depression diagnosis. We're also backing Unmind, which is another company that's providing workplace mental health solutions built on psychological research, but designed with UX sophistication. What's notable in their attention to personalization and employer alignment is something that we really care about at TELUS. And as we regularly test and roll out digital health tools within our own employee base before broader deployment. When we're evaluating companies in this space, we're asking them a few main questions. So maybe the first one is, does your solution recognize how mental health symptoms manifest differently in women? So across depression, anxiety, PTSD, and beyond, what does it reflect that in clinical logic, content, and UX? Another question is, are hormonal shifts, such as menstrual cycle, postpartum, menopause, trauma histories, or caregiving stressors actively integrated into the care model? Not just referenced in messaging, but actually integrated. Can the platform offer flexible asynchronous pathways to care, such as self-guided programs, peer communities, or AI-supported triage to address the growing labor shortage in mental health? And this is an important one because the labor shortage in mental health is, as you said, Gal, one of the main issues here. And I would even say we will not look at a solution if it's not taking this into account. And another question is the product designed for continuity and everyday use? So helping users build emotional resilience and mental hygiene proactively, not just in acute or crisis scenarios, but in the day-to-day. We also look closely at, maybe that's lasting interoperability with other care pathways, because mental health, as mentioned, rarely exists in isolation. It's connected to everything else. So one example is our investment in Home Thrive, which supports caregivers with behavioral health tools and navigation services. And it's an important bridge between mental load and systemic burnout. I will also re-mention Vera Health because menopause-related mood changes are not treated as a rare or an extreme case, but rather as a central driver for quality of life and productivity for women. So overall, we're looking for platforms that meet women where they are and that view mental health not as an add-on, but as a fundamental determinant of health outcomes across the board. We believe the future is whole person care and everything affects everything else. So if your product supports a chronic condition without addressing mental resilience or caregiver support, you're actually missing both outcomes and the market potential.
Yes, I couldn't agree with you more. It's one of the all the reasons that you listed are main reasons why we invested in Gemini Health and the world of providing continuous care to people with mental health challenges and supporting their clinicians, because in this era of AI that we live in terms of, you know, just supporting efficiency of healthcare workers, individuals can lead healthier lives and interact with their clinicians throughout their days. So I agree. Now switching gears to the second clinical area we wanted to talk on, longevity. Longevity is definitely the hottest word in town these days. And over the past 5 years, it has really gotten a lot of attention, mainly because of advances in biotech, aging research, and a lot of tech-driven investment. And we saw that people are focusing and talking about not only extending lifespan, but actually improving health span, which is the number of years people live in good health. Now, achieving meaningful gains in health span depends on the ability to personalize care and target interventions to your unique biology, which is exactly where precision medicine comes into play. Now, this is especially critical in women's health, where biological sex and gender significantly influence disease risk, symptom presentation, treatment response, and diagnostic accuracy. Yet for decades, particularly before the NIH Revitalization Act of 93, women were systematically excluded or underrepresented in clinical trials, which basically led to health interventions and diagnosis to be built mainly on male-centric data. As the longevity movement gains traction, there is a growing recognition that extending healthy years of life will require addressing these historic gaps and ensuring that precision tools are developed with gender-specific insights from the outset. We see it in the Lionbird portfolio in our company, Phase V, in the world of looking at clinical trial results and understanding how it portrays differently in different subpopulations, and with our focus today, how different conditions act differently across both genders. Now, how do you see this relationship between precision medicine and women's health evolving as part of that broader longevity movement?
From our perspective, the connection between precision health and women's health is essential to unlocking health span. The momentum we're seeing around longevity is exciting, but it's also a chance to correct for decades of exclusion in healthcare design, as you mentioned. Until relatively recently, women were grossly underrepresented in clinical research, which has left us with algorithms, diagnostic protocols, and even dosing guidelines built on data that doesn't reflect half of the population. So we're very aware of that. And at TGV, when we evaluate longevity startups, we're specifically asking them those questions. So for example, does this company recognize how biological sex and gendered life experiences influence the aging? Are the company designing longitudinal models of care that account for hormonal milestones like menopause, pregnancy, postpartum? Are they generating or leveraging unique data sets that include women and underrepresented populations in ways that can shift clinical practice? And this is extremely important. This is where our portfolio company, Payor, is doing fascinating work. They're using whole body scanning, and their approach allows for earlier identification of risk factors and changes across multiple systems, something particularly important in women's health, where symptoms are often diffuse or underreported or misattributed. So by enabling longitudinal monitoring and connecting those insights into actionable care pathways, QBio supports more personalized and preventive intervention that can evolve over time. It's not just about identifying disease early, it's about understanding the patterns over time and enabling interventions before decline sets in. This is what longevity is about. So this kind of infrastructure is especially powerful when applied to female patients, because that's where symptom variability and diagnostic delays are more common. We're also seeing growing interest from our TELUS healthcare centers, we call it THCC in Canada, which serve as real-world innovation hubs for new health technologies. These centers are actively exploring how to bring precision and longevity tools into everyday care, not just as one-off tests, but as part of sustained, affordable, and actionable health journeys for patients. This includes evaluating biological age, hormone levels, stress markers, and crucially, making the results meaningful for both patients and providers. We filter for real world applicability. This is why we test it in the field. It's not enough to detect, you need to plan to intervene. You need to have a good plan. So that's where companies that marry deep science with strong UX, accessible delivery models, and partnership with payers or primary care networks, these companies will stand out. And the goal is not just to extend life, but to improve also, of course, the quality of life and agency that people feel throughout their lives. And when you design that system with women in the center, the ripple effects are enormous for families, workplaces, communities. So bottom line, we are bullish on longevity. We're actively looking for solutions in this space, and we're even more bullish on inclusive, precise, and scalable pathways to get there.
This is the future, and we can't wait to see what happens when we are not only advising patients on what not to do, but actually giving them the tools that will take them to where we want them to be in terms of leading a healthier life. And, you know, another question that comes to mind many times when we're talking about selling and going back to our section around commercialization, founders that are building point solutions for a specific condition. What do you view as the do's and don'ts? How do you think about it from the perspective of platform potential, and what are the things they need to be thinking about?
So this is a topic that we discuss quite often in our team, point solutions versus platform solutions. And we have a thesis on that. So point solutions can win your attention, can win our attention, but platform solutions win trust and retention. From a TELUS health standpoint, we actively seek out solutions that can layer across life stages or conditions. So it needs to be as wide as possible. A menopause support tool that can later address bone health or cardiovascular risk, for example, creates more value than one locked into symptom relief alone. Similarly, we look for architectures that support future integration into broader benefits ecosystem, cross-condition, cross-demographic, and cross-market. So you don't necessarily need to have the wider platform from the beginning, but you need to have it in mind when you design your product. We increasingly prioritize platform thinking over narrow point solutions. And while, again, it's acceptable and often strategic to go to market with the focused use case, a specific chronic disease, for example, your long-term defensibility will come many times from building modular or extensible platforms that can address adjacent needs or multiple populations.
And as we're getting as we're getting to the end of our discussion today, I want to ask you, Rafit, what you feel are the most important chronic care related questions founders should be asking themselves. And one last surprise for the end. What is the subsector within women's health you personally think you should be doubling down on as founders?
Okay, so let's break it down. A few questions when you are designing your product, right? So does your product adapt to flare-ups or symptom cycles? Are you capturing real-world data from women managing multiple conditions? Is your solution designed for year-long engagement, not just episodic usage? Have you engaged caregivers in your design? They are many times the glue of chronic care. Can your tool flag underdiagnosed conditions? Fibromyalgia comes to mind, endometriosis or autoimmune. Have you integrated screening or navigation support for comorbidity, specifically comorbid mental health needs, as discussed? So yeah, of course, there are many more questions, and we've discussed them, and you have them on the cheat sheet. Personally, if you want to double down, I will go with the longevity theme that we've discussed earlier. I think it's key. I think it's both, it's hype, but also I think there is real value there that is still not captured. Given that there is so much potential data and information about our bodies that is still not collected and analyzed in the way that it can be. And I think that most of the potential in longevity platforms actually lies in women's health. Again, because that's where the largest gaps are. I mean, there are so many things in women's health that have been historically wrong. And I'm feeling that personalized care and longevity as a whole is the potential for us to solve for these things.
Thank you, Hafid. I couldn't agree with you more. I think that if anything, these days I'm both excited and hopeful that founders will be able to seize this opportunity and not only tap into new territories of chronic illness or tap into old territories of chronic illness in better ways, but actually build sustainable, precision-driven digital health solutions that actually make a difference in cost and care.
Yeah, and thank you, Gal. Chronic illness and precision is where the complexity is, but also where the scale is. And the solutions we build today will shape the future for healthcare for everyone. We're super excited to be on this journey together.
So all you founders that are listening, if you are building a chronic care tool with intelligence, personalization, and empathy, you're not just doing a behavioral medicine startup, behavioral health or digital health. You're actually building the next generation of women's health startup, and you didn't even know it. And that can generate additional investment dollars for you and great commercial opportunities to build an amazing, scalable startup. Thank you all for listening, and we'll see you next time on the Lionbird Wings.
Thank you.